For our community project, we decided that we are going to focus on the role of patient advocacy for patients with Duchenne Muscular Dystrophy. So Duchenne Muscular Dystrophy, what is it? So Duchenne Muscular Dystrophy is a disease caused by a defect in the dystrophin gene, mostly in males, that causes for there to be a lack of dystrophin in the sarcolemma membrane, leaving it vulnerable to contraction-induced injury. Duchenne Muscular Dystrophy is characterized by 5 different stages: pre-symptomatic, early ambulatory, in which patients may appear clumsy and fall more often, late ambulatory, in which patients are still able to move around by themselves with difficulty, early non-ambulatory, in which patients lose the ability to walk independently, and late non-ambulatory, in which patients lose the ability for basic motor function. Duchenne muscular dystrophy requires the care of primary care physicians, pediatric neurologists, pediatricians, occupational therapists, psychologists, physical therapists, and dietitians. So returning back to our original point, patient advocacy. What is it? So a patient advocate is a third party who takes on a patient's case and helps them get the services they need while making sure they are being satisfied and serviced as best as they can. Often these people are nurses or social workers who care about a specific patient, or these can be advocacy groups that focus on a specific disease. So what is the role or importance of a patient advocate? The patient advocate's role is to help the patient find the best professionals that can meet his or her needs, to help the patient with navigating the healthcare system, to present and clarify treatment options, to help the patient as a liaison between healthcare professionals and the patient, to help give the patient added autonomy from an educated and professional figure that can provide necessary insight during difficult decisions, and lastly, to help provide the patient with general support and answers to any questions throughout the course of the disease. And now we're going to talk about the importance of patient advocacy for under-resourced Duchenne muscular dystrophy patients. On average, non-Hispanic Black or Hispanic children were tested for Duchenne muscular dystrophy at later ages than non-Hispanic white children. Costs can be up to $22,000 more than a healthy person, which is shocking considering lower-class individuals may have an annual income only slightly higher than this number, which doesn't really leave treatment as an option. Society's tendency to focus on the burdens of many different types of treatment for individuals with Duchenne muscular dystrophy that have access to healthcare resources focus the attention away from under-resourced individuals who still have the same disease but don't have the same access to as many treatment options. So what can we do about the need for patient advocates for patients with Duchenne muscular dystrophy? First off, we can educate and create awareness about the role of patient advocates for individuals living with DMD. But we can also support public health programs that increase the amount of patient advocates within the healthcare system in general. Overall, we hope that you gain a sense of what patient advocates can do for patients with Duchenne muscular dystrophy, and we wanted to say thanks for watching. Our references are included in the description.